valve dysfunction and radiation of fibrosis or hardening of the pelvic floor tissues and restrictions in the vaginal canal. And by far there are more effects from treatment than what I've listed, but I'm listing some of the primary ones that we see and treat in physical therapy. So what common symptoms do the tissue impairments have on cancer survivors? There was a nice article I read, and I have references at the end of my slide, that was pelvic floor disorders and sexual function in gynecological cancer survivors. It was a cohort study. It had multiple gynecological cancer survivors, and I believe close to about a third had ovarian cancer in this study. They said that, and this was kind of surprising to me, that only about 40% of survivors of cancer reported ever being asked about their urinary and fecal incontinence or sexual function by their oncologist. About 70% of survivors reported some type of urinary incontinence, so a high prevalence, and about 43% some type of fecal incontinence that had a significant impact on their lives. And in general, that the survivors of the cancer were less likely to be sexually active than a control group, which was gynecological patients. So in kind of summarizing this, this was a nice quote from that article, that incontinence and sexual dysfunction should be discussed more open with patients with cancer as a potential long-term side effect of cancer treatment. A well-informed patient may be more likely to mention problems and then seek out treatment options.